The CDC's vaccine panel acting quickly to consider whether to recommend Moderna and Johnson & Johnson's COVID-19 booster shots.
Less than 24 hours ago, the FDA gave its approval not only for the boosters, but also for people to go ahead and mix and match them. Joe Hankey has been monitoring the CDC's meeting for us today. Joe, they're still debating at the moment, but if approved, when could these new booster shots be offered?
Well, rather quickly, CDC approval is the last hurdle before these shots would be made available. Approval, as you mentioned, could come at any time. Final debate is underway right now. And based on the CDC's other recent vaccination approvals, these booster shots could possibly begin as early as tomorrow. An advisory panel inside the CDC today weighing the risks and benefits of Americans receiving booster shots of Moderna and Johnson & Johnson's vaccines. CDC Director Dr. Rochelle Walensky reminding the panel of its importance as the pandemic continues.
None of us individually can predict what may happen next, and none of us individually can know exactly what to do. But together, we can be prepared and make the best recommendations to protect the greatest number of people.
Data from the CDC shows as of Friday, 99 million Americans could be eligible for a vaccine booster dose. Dr. Anthony Fauci tells NBC News there are several benefits of expanding the use of booster shots.
You want to get people optimally vaccinated and optimally protected.
Information presented in the CDC's meeting Thursday showed common side effects from the Moderna booster were pain at the injection site, fatigue, muscle pain, headache, and fever, similar side effects to after a second shot. People who received a Johnson & Johnson booster reported fever, fatigue, and headache. A main question the CDC considered is whether a third Moderna or second J&J shot is safe and beneficial. Data showed 94% of nearly 5,000 reported adverse reactions were non-serious, a rate similar to initial vaccinations. And the third Moderna shot and second J&J shot increased people's immune response. CDC officials also considered whether vaccine booster doses can be mixed and matched. If you previously received Moderna, for example, could you now receive a Pfizer booster? Slides published this morning suggest the CDC could approve mixing and matching, but if available, receiving the same brand booster as original doses would be recommended. And if approved, recommendations for a Moderna booster could be similar to the recommendation for Pfizer boosters. Boosters would be for people 65 and older or other adults with certain high-risk categories, with the booster being received 6 months after being fully vaccinated. For Johnson & Johnson vaccinated folks, the booster would be given 2 months after an initial shot, and for anyone 18 and older.